Welcome, audience from all over the world. This is an exciting day here in America, and I believe wherever you are in the world, it's a great day for you too. This is another edition of Broken Not Shattered. Your host Ike O, and I'm so glad that my G's back. So I'm bringing in my G, my co-host OBG. What's up, Obi?
All right.
You're good. Listen, bro.
Good.
Good. May is Mental Health Month in America, Mental Health Awareness Month in America, and I mean, anywhere you go, you know someone who either has struggled with it or is struggling with it. But most people don't even know what it's all about. Most people don't have a clue how to deal with it. But guess what? Who we have in the house today, man? We have the best of the best of the best. You know, that's the thing about BNS, right? We try to bring in the best guys for the business. What are you gonna say,
Sure.
man?
Do you know that mental health is one of the reasons why this platform is founded? If you can remember.
Yes,
Remember,
definitely.
it was in the bid to add voice to cut down on the rate of suicide,
Right.
which is driven by mental health.
That's right.
So this is on point. And I'm happy we have Doc on board.
So, ladies and gentlemen, out of everyone else, I could have chosen to be our guest here. Our guest today is one of the best in the best. He is one of the top medical psychiatrists in the DC area, if not the United States itself. Dr. Ike Nauchi. Hey, Doc, how are you, sir?
Good. How are you?
All right, Doc. Hey, Doc. Listen, first, let's listen, man. You're here because, as long as I'm concerned, you are the best psychiatrist I ever know. But full disclaimer, because someone's gonna say, "Hey, I know that guy. Dr. Ike is my first cousin," but he's not here because he's my first cousin. He's here because he's the top psychiatrist in the DC area, if not in the United States. Speaks across the country, has a voice internationally, and he is the chief medical director for MBI. Correct? Still there?
Correct.
All right, yeah.
Yeah.
So yes, good. So we're looking forward to this great opportunity to speak to you this afternoon as we discuss mental health issues across board as much as we can in the next few minutes. How you doing, Doc? You look pretty cool, bro. You looking
Good.
cool. You looking cool.
I'm going to give a couple other things just so that you guys won't think I'm only here because Ike is my first cousin. His mom is my dad's younger sister. I was the medical director of Washington, D.C.'s Comprehensive Psychiatric Emergency Program. I was the former vice president of the American Association of Emergency Psychiatry. I also, in 2007, went with a joint military and civilian group that went to Israel to learn about a method they use to combat post-traumatic stress disorder called stress inoculation. And that we were guests of the Chief of the Israeli Air Force. So I do have some actual real psychiatry background and some expertise. So it's not here. I'm not just here because of my cousin.
Thanks, man. And there's much more that you haven't even talked about that you're doing in the field. And we're going to have Dr. Ike back in full force. Let's take a quick break and we'll hear from Dr. Ike. Our guest today, Dr. Ike Nauchi, Broken Not Shattered. Hey, Doc. Question number one. We've dealt with the full disclaimer. Everything I've known in life, good or bad, you taught me, right? That's all, all the good things I learned, you taught me. All the bad things I learned, you taught me. Well, you're here today because we have this issue we want to discuss. What is the most? How would you describe mental health?
Mental health?
Yeah. Yeah. How do we know that someone has a sound is in good mental health?
I guess mental health, would be catching me off guard with that statement. But mental health definition would be, in my opinion, would be generally, I guess anything that encompasses the mind, your thoughts, your feelings, emotions, your ability to comprehend things. We use mental health now generally in regards to our overall well-being from a mental perspective.
So, what is the importance of having a very good mental health then?
Well, we know that the mind affects everything. So you have to have a strong body, strong mind. If your mind is, if there's things wrong with your mind, it's going to affect your overall well-being. And there's been studies that, for example, patients who have depression have have higher sensitivity of pain. So if you have depression and you have a physical illness that causes pain, maybe back pain, you're going to feel more pain. Anything you undergo pain wise, if you're depressed, the pain is worse. So there's so many direct links of the importance of having sound mental health as regards to physical illness and overall well-being.
Wow, I didn't know that. That's good news. I didn't know that. Okay, Obi, go ahead.
Well, I'll begin with saying, Doc, it's nice to have you.
Yes, nice to have you too. Nice to see you.
You're looking good.
Thank you. You too.
So Doc, because of today's topic, I tried doing a little research, and I was surprised with my findings. But one of the striking things is looking at various levels of mental health condition. Discover we'll have about 7 of them. Can you throw more light on some of those mental health conditions? Maybe that people didn't know, or you feel people should be aware of.
You mean as in diagnostic criteria, like schizophrenia?
Yeah.
Okay. There's many mental health diseases or conditions. I'll give you some broad ones. So schizophrenia, which is one of the psychotic disorders. People will be hearing voices, seeing things that aren't necessarily there, having paranoid thoughts that people out to get them. They'll have false or fixed delusions. And there's also a cultural perspective, because there are things that we might say in Nigeria, which abroad would be considered, oh, this guy's psychotic, but we definitely clearly believe. A lot of Nigerians believe in juju. And some of those beliefs in Nigeria here would say, oh, this guy's mentally ill, but you have to also know there's a cultural perspective, and what might be an illness in America may not be an illness in Nigeria, and vice
Correct.
versa.
Right.
There's mood disorders such as depression, major depressive disorder, when people are extremely sad, they cry, they have decreased concentration, decreased memory, feelings of hopelessness, decreased energy, suicidal thoughts, lack of sleep. With depression, people don't realize that when you're depressed, it affects your concentration and memory. So I've had patients who thought they're doing well and became depressed, and academically their grades go down. In their work, they start forgetting things and making huge mistakes. And you find out, you think the person is underperforming, but really and truly what the real problem is, they're actually depressed. And if you don't treat the depression, you end up losing your job. I had a patient who was a George student at Georgetown, an Oyibo girl. She had a perfect A's going into college, went to school, got depressed because she's away from her family. And she had a full scholarship. And because she became depressed, decreased concentration, decreased memory, she was unable to perform academically, and her grade point average dropped below a C, and that automatically meant that she was going to lose her full scholarship. And the young girl made a suicide attempt.
Wow.
Managed to, explain to her what was going on. She thought she'd just become dumb, and they took her back to Oklahoma, where she had family support. So you've got to see that link, and you understand that, we know about depression and sadness, but yes, depression will affect your whole life. Bipolar disorder, when you have depression and you have manic episodes where you're full of energy, you talk super fast, you might be delusional, having bizarre thoughts, you think you're on top of the world, you think you can achieve anything, you are impulsive, you make erratic decisions, and those kind of things affect your whole life. Meanwhile, people think you just, man, this guy's a little bit crazy, but it's not crazy. He's just in a manic state because of bipolar disorder. And once you get the right help and treatment, you can take care of it. Post-traumatic. Yeah.
How about anxiety? Is that
anxiety? Well, I'm getting there. Okay. Anxiety is a common one. People get anxious all the time. So under anxiety, you have things like generalized anxiety disorder. When you worry most days of the day, most days of the week. So you're always worrying. When you worry a lot, it can affect you physically. We have some, in America they call it butterflies in your stomach. You might find yourself having panic attacks caused by anxiety, where you have difficulty breathing, feel like you're about to lose control. You feel like you're about to, maybe even feel like you have chest pain or about to die. And it's not a heart attack; it's just anxiety from a situation you find yourself in. Post-traumatic stress disorder. Somebody's exposed to extreme trauma. Maybe they were beaten up in school, or got beaten up by police. Or they saw a car accident where somebody died or was severely injured. They now start having nightmares and flashbacks of the incident, and they get triggered. Maybe every time they go out in the car, they're and the tires screech of a car. It reminds them of the accident. The accident, and all of a sudden they'll start having flashbacks. So they'll start reliving the incident they had, the original car accident, and they won't be able to function. So these are all the things that are there that you don't ignore, and you can get treatment and you get help for them.
Well, doctor, I know there's a lot of them that you can actually go into, basically using the DSM. Is that what you guys call it?
Yeah.
Yeah. So, but
statistical manual.
Right. So, yeah. So, and I've worked with you closely at some point, and I've seen the way you actually work with your patients. You're very dedicated to your patients. So the approach, I guess, is everything you do has to be patient-centered, correct? And
yes.
Why?
Yes, because everybody's different. So, we have guidelines and we have ideas of what fits for everybody, but it's different. Mental health is not one of the most exact sciences in medicine. If somebody has appendicitis, the treatment is to remove the appendix. Generally, most people only have one appendix. While mental health is not so exact. You don't just go in there and cut the thing out. The person may have depression, but there's different causes of the depression. They may have anxiety with different causes of that anxiety. So you have to deal with the patient and see what the reason for the diagnosis and the reason for that they develop this illness, and then the treatment could be different. Some people prefer to be treated with medication. Some people do better with therapy. Some people need a combination of both. So patient-centered care means that you meet the patient where they are and you find out the best fit for them.
The best fit for them. I like that. Obi, go ahead. I'm going to come back with Doc with that question on the best fit for them. Obi, what's your question?
Okay, that's fine.
Yeah.
So why Doc was talking earlier, he made mention of the differences in location and approaches. So you're saying what might be defined as mental health condition in a developed nation and in an undeveloped nation might differ to an extent. Am I right?
Correct. Very correct. Yeah.
Okay. So because I want to agree with you to an extent, because on a lighter note, sometimes I might need money and have money issues that would drive me into depression. And I'll have my boss here tell me to look for a therapist, which I know money might be my issue. He understands what I'm talking about.
Right.
That's by
It's true.
Where I'm driving to with my question is this. I'm looking at post-traumatic stress disorder and eating disorder. Now, I understand that there are issues what are the issues that might drive one into such conditions? And is there a remedy or a first aid for one if you discover such issues? What can you offer to one before you begin to take it further when you discover such conditions? Because it looks more like a very familiar issue within the environment.
Well, post-traumatic stress disorder, otherwise short form called PTSD, is somebody who's been exposed to extreme trauma.
Right.
Like I gave you examples of being in a car accident or seeing someone die, or even maybe just a situation where you think you're about to die. Let's say you're a woman and you're approached by a man and he's trying to rape you, and he's on you and he's grabbing you and holding you. He doesn't do anything, no penetration, but just the fact that for that 4 or 5 minutes as you fought him before someone came and rescued you, you felt you were going to be raped. that will cause post-traumatic stress disorder. And then also your own individual fears. So something that may not scare me, but somebody who has a phobia to ants or someone has a phobia to big cockroaches, the idea of being trapped somewhere where let's say they were trapped and they couldn't move and a cockroach was climbing over their face could cause them severe trauma. So as a result of that, you have all these different things, right? If you have an eating disorders, a lot of eating disorders can be caused by, a desire it can be a desire to get thin generally, and you continually focus on trying to get thin because you're teased or bullied or made to feel less than because of your weight, whether it's too much or too thin. Or also things like sexual abuse. There are people who have because they were raped or sexually abused when they were younger because of the kind of figure they have. They now might eat excessively to change their body shape so they won't be
body shamed,
right?
Correct.
They won't be in a situation where men will find them attractive or vice versa. And also sexual abuse has also led to a number of eating disorders too. So if you find yourself in those situations, first of all, the first thing you always want in mental health is support and understanding, right? And people to recognize the fact that even though we can't see it, and that it does count and it is serious, right? I was discussing earlier on about
the invisible.
Yeah, there's the mental health is the invisible illness,
right?
And that's the reason why it's so much harder. Before doing psychiatry, I did pediatrics. I did a residency in pediatrics at Howard University, and in Howard, as a pediatrician, it wasn't that difficult to get the parents to understand their kid was sick. And psychiatry, because you can't see the illness, you can't see you can't see depression, you can't see schizophrenia or bipolar disorder, you can't see anxiety, right? You can see a broken leg, you can see someone who's vomiting or somebody who's bleeding. You can see all those things, and people take those things seriously. So you've got to make sure that we continue to educate people to understand that even though you can't see it, this stuff is serious. So making sure that you acknowledge the person with PTSD, the person with the eating disorder, as their complaints and their struggles are valid, is the first step to getting them better.
Wow. Look, we're gonna take a short break. While we're taking that short break, Obi, your Wi-Fi is tripping, so maybe you want to fix it out. I know you're back in Nigeria, so sometimes that happens. But we're gonna take a short break and then we'll come back and Obi will take care of his Okay, we're back with Dr. Ike Nauchi, one of the top psychiatrists out here in the DC area, speaks at conferences all over the country. And I know he's going to go global very soon because a lot of doors are opening out there.
I'm global now.
There you go. Okay.
Global now.
We'll say so, Carl. Say so.
Global now. Look at me. No, I'm saying no. Look at me. I'm being seen in Nigeria.
Actually, you're actually seen in Nigeria. You're in Kuwait. You're Qatar.
You see?
We have audience in the UK. But I'm talking about you go down there and tell them what they need to know to fix their mental states. Ike, it's been actually, Dr. Ike, it's been a joy talking to you. Obi is trying to sort out his stuff in the background, and we'll come back. While Obi's out there, the two questions I have for you. One of them is actually the issues of personality disorder. What is a personality disorder?
Personality disorders, there's a number of personality disorders. Okay. Basically, they are, I guess there are different types of personality disorders. And they are referred to as I guess you have people are different, but it becomes a disorder when it affects your life situation. So people can have personality traits. You can have like a borderline personality disorder, histrionic personality disorder, narcissistic personality disorder, which they've kind of removed from the DSM-5. Somebody like Donald Trump is a narcissistic personality disorder, where he feels like basically, and we all know people who are narcissistic, right? Someone like a narcissist would feel like they feel like they're basically God's gift to the world. They are pompous, arrogant. They are charming, but they're generally unfeeling. The most important person that they're going to take care of, and the only person they really care about is themselves.
Mm-hmm.
They're not really concerned about other people and what the pursuit of whatever goal they have, how it affects anybody else. It's only concerned about themselves. And when you hear Donald Trump talk, it's always about him, and he's never going to take fault. It's always everybody else's fault, because he in his own mind, he's the greatest thing ever. There's borderline personality disorder.
What is that one?
Borderline personality disorder. The reason they called it borderline, because they said they were borderline schizophrenic. So there were schizophrenics, the people who we in Nigeria would call madmen, right?
Right.
But they were borderline schizophrenic because they were so all over the place. But borderlines are very. If anyone's seen the movie years ago, Fatal Attraction, that
right.
person's borderline.
Yes, right. Mm-hmm.
They're referred to as being stably unstable. So they're always in crisis. If you have that person, that friend who's always in crisis, there's never a time when their life is just smooth, and it's only in their own mind where they're creating these crises. They can't get along with people. They're always in conflict with everybody. And they have this, they refer to them as being, things are either black and white. There's no gray. So there's a book written by borderlines called I Love You, I Hate You. Because they either love you and think you're the most wonderful person in the whole wide world, or they hate you with a passion.
Oh, I know someone who fits into that picture, but that's all right.
There's a lot of people. And here in psychiatry, if you're in private practice, they say that it's good for you to have no more than 2 borderline personality patients in your practice, because they will suck up all your energy and demand so much time. They're very, very difficult. If you're married to a borderline or dating one, man.
Yeah, I know.
It's Wahala to the 100th event. If someone has concerns about this, go to the dictionary, look it up, and you'll see, and you might find some traits. It's very difficult, and for them, just like with narcissistic personality disorder, they need specific types of therapy. Here it's called EMDR, but you need therapy. That's the only way. Medication is not going to touch borderline personality disorders.
Wow. Let's talk about therapy. Well, Obi, give me a thumbs up, Obi, when you're ready to come back in and everything is sorted out, and we'll bring you back in. So let's talk about therapy, right? I have a lot of friends who are into that, I'll say that space, but who are therapists, right? Mm-hmm. And then I have those who are the life coach. Is there a difference what is the difference between a life coach and a therapist? Because I can see some guys who are life coaches.
A therapist is a general name for people who do therapy, right? Okay. Right. So people who do therapy, a psychiatrist like myself. So I'm a medical doctor who went to medical school, and then you do in America, you do a 4-year residency in psychiatry. During that period, because you have a medical background, we're able to do medical, because there are a lot of things that affect the mind that are not necessarily that are medical. Diabetes can make someone present like they are they're psychotic. So having the medical background, but we also learn about therapy. We learn the medication to treat psychiatric illnesses. That's one person. You have psychologists. Psychologists can go different trainings. They go from you can have a psychology degree, you can have a psychology master's degree, then a PhD or PsyD, who are very, very, very well trained. And they do different types of therapy: cognitive behavioral therapy, psychodynamic therapy, psychoanalytic therapy. There's so many different types of therapy. Then there's like EMDR and different therapies. They're very well trained. In America, even social workers do therapy. But you basically, and there's also pastoral counseling. I'm not too familiar with the extent of their training, but they also do learn therapy too. As for coaching, and they have different types of coaches, right? So coaches aren't therapists. They don't have any therapy training, but they learn how to, they have motivational coaches. So they basically will motivate you and help you to organize your life. They have relationship coaches who aren't, as I said, most of them don't have therapy training, or you can do, if you're a therapist, you can do coaching on top of it, do a coaching degree or coaching certificate. Sorry, the sun is really a lot. All right. You can do a coaching certificate. But they also have a role too to help organize your life. But in regards to deep psychological issues, coaches aren't the ones that will be doing that.
Doc, for that, we just have a 5 minute. We just have 5 more minutes left. I guess that was
The
the
warning.
back end letting us know that we just 5 minutes to go. I'm glad you talked about the pastoral counseling. I know that some pastors have taken on, uh, in some ways, the issue of a therapist or trying to talk people who have some traumatic experience of some sort, using biblical balances, and I understand that that is needed at a certain point. However, if you don't have any clinical background, then you might be doing damage to the person you're actually trying to help
Exactly.
than actually that. So I caution people that I know that, hey, you can see a pastor. I have a pastoral background, so I'm very comfortable in that space. But I'm not a licensed therapist, right? So I can counsel, but I can't go into therapy. A counselor is someone who can just actually guide you, pretty much almost like a coach, and give you the guidance that you need to go into it. But when the issues have escalated, then I think I'll be the first to tell you to go to therapy, because I personally, after some experiences I've had in my life, had to go to therapy, and without that therapy, I don't think I'll be where I am right now. And you know exactly what I'm talking about. Um, but there's a stigma around it culturally everywhere you go, especially in the third world countries where uh, we have a lot of audience that will watch this program. Um, how do we deal with the stigma, Dr. Ike?
So before the stigma, I have to make sure that things like depression and suicide. I know in the Nigerian space, there's a lot of coaches. That is serious stuff, and it's not just everybody. Like you can't just have anybody doing brain surgery. So when it comes to depression and suicide, you need somebody who understands the whole depth of what suicide is, depression, the risk factors. Um, I lectured extensively on suicide, and people remember years ago Virginia Tech when they I think it was the second mass shooter, the guy in Virginia Tech where he killed I think 34 people.
Right.
I went down there afterwards to coach their counseling, to teach their counseling center on emergency psychiatry and particularly suicide, right? So it's not just every Tom, Dick, and Harry that you want to be having suicide. Even the therapist, not every therapist is comfortable with suicide. Make sure you find somebody who knows what's going on, and make sure somebody, you don't have to know everything, but you've got to know when you don't know, and you've got to have the humility to refer to somebody who knows better. In regards to the stigma in America too, but the stigma um, more so in our supposedly third world cultures. Um, Asians, Africans, um, Indians, everyone's scared of mental illness. But really and truly, the it's for somebody who does mental illness now, having done pediatrics, it's not that big a deal. It's like any other illness, diabetes, high blood pressure, asthma. As long as you understand it and you get the person the right treatment, you can overcome it. You don't have to tell everybody about it, and you don't have to force. I make sure that education is the most important. I educate the family, educate the patient, educating their jobs to understand that this person is going through something. Um, you have to be selective in who you tell, but you want to make sure that the right people are hearing it and taking it seriously, and the patient themselves has to take it seriously. That's the biggest issue. I know we ran out of time, but I've given an example of a patient of mine
No,
who
go ahead. Take your time, man. Take your time. This is DNS. We can talk about it.
I had a patient at one of the hospitals here, Sibley Hospital. She was a Oibo lady. She was it's a white lady. She was senior vice president of a software company, and she was depressed and suicidal. She went and told her boss before she had a presentation that I'm really depressed and I'm going to go home after work. I'm going to go home and kill myself, right? So her boss looked at her kind of strangely. He said, "Why do you want to do that?" He said, "Well, let's go drink some coffee." Took her to drink some coffee, and then told her not to go kill herself. And then she went off to do the presentation. On the way back from the presentation, she was going home straight to kill herself, and then drove by the hospital where I work. And then she decided to come in to give it her last chance. While on the ward, I had her. She explained to me. She said that I'm so sorry that I'm not trying to kill myself. I'm in so much pain. She tried to kill herself while she was on the ward. We had to have her on 1-to-1 where somebody followed her around the ward, including to the bathroom. She had to have the door open, right? That's
Wow.
how suicidal she was. And I always say that, suicide, this woman is one person I think, if I think of it nowadays, if I'd bet, I'm sure she probably eventually killed herself because she was in that much mental pain. But I always say that if she had grabbed her chest and fallen to the ground, or she started having a seizure or throwing up blood, right? Her boss would never have told her, let's go drink some coffee and sent her to do the presentation. He would have called 911 immediately. Now, a heart attack, grabbing your chest, that will probably kill you. Seizure is not going to kill you, and coughing up blood is not going to kill you. But the perception is, like I said, they can see that, but they can't see mental illness, they can't see psychiatry, so nobody takes it seriously. I have patients who've made serious suicide attempts, and when they get saved, let's say they make a suicide attempt on a Friday or a Thursday, they're asking on Sunday, I need to go back to work tomorrow. Can I be discharged? The guy with a heart attack is never saying, man, let me go back to work on Monday.
Right.
The guy who's throwing out blood isn't asking, I need to go back to work on Monday. But even the patients don't realize how serious it is. When you see the families will say, well, why is he depressed? He has a great family. He has wonderful kids. He has a great job. What is he depressed about? But nobody says to the guy who has pneumonia, why are you coughing? Why are you having a fever? You've got a great job, great family, great kids. No one says that. And psychiatric illness is the same. It's a medical illness that has the same. It's not something people are doing on purpose. It's just something we need to take seriously. Something we need to treat.
So that's why it's called the invisible illness, because we can't see it.
Illness, definitely.
But it has taken out a lot of people. Literally, a lot of people. Recently, the suicide rate is pretty much high, especially younger folks, right?
Yeah.
So, I bet you in the practice you're seeing a lot of, or you're reading or hearing, or a lot of younger people who are actually committing suicide.
Mm-hmm.
What would you address that to?
Well, one of the things that they know, the suicide rate, depression, anxiety rate has increased significantly since the development of social media. And once kids got smartphones, the rates of suicide and depression, anxiety, and mental illness between 2000 to 2009 was much smaller than when kids got these smartphones. From 2009 up, the numbers have just skyrocketed. And there's been an increase in suicide. The rates have been highest amongst young girls, teenage girls, and early 20s. And that's all attributed to social media. And then also, of course, in this situation, the COVID-19 definitely in this part of the Western world really affected a whole bunch of people. Sorry, my dog is okay. Shango, love it. Sorry. So those are definitely issues. Social media is definitely a big issue, and of course, society is different. This generation they don't talk as much as they used to. They spend all their time on their phones. This interaction that we had, where you're more time with family, they always have their heads in their phones. They're more isolated. They're more susceptible to the views and values of their peers versus their families. So
those are the core things that I can actually
social media is definitely a big one.
Wow.
Limiting our children's phone is a good one.
Awesome. Thank you, Doc. There'll be one question from you and then one more from me. And we'll let the doctor go. I can see it's pretty hot where he is. And Shango, the big dog, is telling us, hey guys, let my man go. Go ahead.
Well, I think we're constrained with time, but this is for me a very interesting segment. Like I was saying, ab initio, that this platform is founded on this topic we're dealing on, fighting depression and trying to add voice to cut down on the rate of suicide. It is interesting to see that, Doc, you have a special interest in suicide, which for me is very important to this platform, because one of the things we do on this platform is to inform in a way that we can save life, and this is just it. Mm-hmm. But I want to ask, maybe not to ask you a question, but I want to plead. Yeah, I want to plead that we have Doc come back again when we can explore this the more, because I want to go into asking you your journey with Psychiatrist, and then what is the application, in the underdeveloped and the developed world, because I know the application should be different. How you approach psychiatry to in a developed nation and in an underdeveloped nation would definitely differ. Yeah, but I know that time will constrain us to talk more about this.
Obi, thank you for that. Doc, you wanted to say something, sir?
Yeah, we can go deep in suicide. I mean, my suicide expertise is deep.
Okay.
So hearing that my cousins have this platform, and this is the first time I'm having him on, is questionable. Why he hasn't had me on, because I know how deep my suicide knowledge is across this country. So I would be more than happy to come back, especially.
Okay, so we'll try and see if we can get you back next week. How about that? So we continue on where we stopped, right? Is that a deal? The whole world listening to you. Is that a yes?
Yeah, anytime. I'll come back anytime. This is important.
So we'll work on that.
On any topic is important. We got to educate people. And we got to inform them, and even the therapists and the counselors, if they come on, I can help them become better at assessing suicide and the risks of suicide, when to intervene, when to get people help.
That's I think that's what it's all about, really. This is, apart from this being Mental Health Month, Broken Not Shattered. The name Broken Not Shattered. Part of it was all the components of what Obi was just talking about. It's not just only for those who try to commit suicide. It's for those who have gone through some level of brokenness, and we were trying to encourage them, inspire them, uplift them, and get them moving on to the next level. And our topics cut across everything. And definitely we're going to have you back to Broken Not Shattered. Ladies and gentlemen, my guest.
I just want to say thank you to you guys. You guys are real heroes to actually have this platform and build awareness. You guys are awesome. So thank you.
Thank you. Our last show last week had 744 views. And that's very encouraging for us. So we ask our audience across the world, wherever you are, just keep up with the support. Take out time, subscribe to any of our platforms on social media, and then follow us and get some good news as much as you can. We try to make sure that this platform is kind of healthy. Is Shango there? Does he want to come on camera or something? You can put Shango on camera.
Shango, here, come.
Yeah, let's see Shango.
Let's end on a man's best friend. They say a dog is.
Woo!
Where's Shango? There you go. That's so Shango. That's
That's a big man over there. Wow.
That's a big dog.
140 pounds.
Wow.
Wow. Dr. Ike, thank you so much for your time. We're grateful to have you, and definitely we're going to call you back on this platform. You have a lot to share. The experience is phenomenal. I mean, I sit down with you sometimes and like 3-4 hours have gone by, and you're just talking about experiences and real life stories that I believe people can actually benefit from. I think we're going to try and create maybe once a month. Obi, how about that? A time with Dr. Ike, and that will be your slot once a month. You just come on and talk about anything you feel that is out there that you want to share. Okay, cuz?
Perfect.
Thank you for having me.
That's my boss. Whatever he says happens.
No, you're like chairman.
That's my chairman. All right, dog. Thanks a lot, boss.
Yeah, take care.
All right, take care. Wow, Obi, that was a good opportunity to have Dr. Ike in our midst. This is what we're talking about, brother. It's the invisible illness. There's a lot of awareness, and there's a lot of cure for it. And we're going to try and bring Dr. Ike back in at some point in time. Obi, whatever you have to say, let's wrap up the show. We are 39 minutes in, but it's worth it. It's worth it for us. Go ahead. Man. 1 second, just say what you want to say, and then we'll wrap up. Yep.
I think it will be my turn to say to my audience, love, peace, and more grace.
Wow. All right, buddy. Catch you next week on the next issue of Broken Not Shattered. We need the support. Please join us. Subscribe to our platforms. Go to Instagram, find us where we are, and just give us a thumbs up. Share the information with your friends, and we'll see you same time next week. On behalf of myself and my co-host, Obi, we're out of here. Take care, buddy.